Hello, everyone, and thank you for attending today's webinar on our newly designed Liaison Travel Series. My name is David Boggs, and I'm a Sales Operations Manager. I've been in the insurance industry for 29 years and have spent 14 years in the international and been with Seven Corners for 2 years. And I'm looking forward to bringing and sharing some great news with you today. Joining me is Janice Hendricks, our internal sales trainer for the account management team. She's been with Seven Corners for over 9 years, and has worked with our inside sales team and agent support. So many of you may recognize her name and know Janice.
Good afternoon. We're excited to share information about the updates to our Liaison Travel Medical Plans. To make sure we are giving you the type of information you need, we will be sending you a short survey after the webinar ends. Please respond to that and let us know how we're doing. That will help us in designing future webinars for you and providing other content and tools that will work for you.
Thanks, Janice. Hey, today's webinar will last approximately 30 to 40 minutes. We will introduce the new Liaison Travel Series and address why we decided to update the plans and how we accomplish this task. We're also going to give you a brief product overview. We're not going into a lot of detail, but we'll cover the highlights of any changes and all changes that were made in creating the new product design. We'll also, for those that haven't already have a link, we're going to discuss how to obtain a purchase link from the agent portal. And finally, we'll end with Q&A session at the end. However, if during this presentation you have a question, please enter it into the question box on the GoToWebinar site, and we'll answer them at the end of the presentation. Janice?
Let's get started, Dave. So why this change?
Well, in all my time in the international markets and over the past few years, we've been taking surveys and we're listening now to our agents and consumers. And some of the things that we've heard that are consistent concerns is, wow, too many plans, too many selections. Another is, well, they're so hard to compare. I have to go in and out and I'm not sure which one's right for me. And even from you, our agents, sometimes we hear, I'm not even sure what plan to recommend to my clients. So we've listened, and we are now in the process this year of streamlining our entire product portfolio to reduce the consumer confusion while still offering customized benefits and premium options for differing budgets.
That is great, Dave. Can you explain how we did this?
Well, first of all, we tackled the issue of consumer confusion. So we created plans with 3 options which clearly reflect good, better, and best. Now, for some of you, this is going to be fairly simple. Our Liaison Economy is a good plan and is based on most of the benefits you'll find in our Liaison International. Next, our Liaison Choice is a better plan and follows many of the same benefits that you'll find in our Liaison Continents. And finally, the Liaison Elite. It is our best plan, and this similarly matches the Liaison Majestic. So don't fear, you're still going to have an International Continent Majestic options. They're just now called Economy, Choice, and Elite.
Okay, let's also talk about reducing the amount of time your clients spend choosing a plan that best fits their needs and budgets.
Well, we listened here. One of the main things we have is there's too many brochures, there's too many web pages, there's too many links. Once again, a lot of consumer confusion as to where to go, what to research, and where to look. So by reducing the number of links from 3 to 1, your clients will still have choices because they still have the Economy, Choice, and Elite options. The new Liaison series eliminates the need for your clients to shop around to compare plans and premium. It can all be done in one easy-to-use links. Now, this still gives the opportunity for you, the agents that like the specific product, say you recommended the Majestic. Simply when talking to your clients or sending an email, recommend the Elite option. Now, one thing I do want to point out on April 30th, any existing International Continent or Majestic link that's out there on a current website will redirect to the new Liaison Travel Series links automatically. And the plan comparison will still lay each plan out side by side. So when you visit the agent portal, you'll only see one link now, Liaison Series, because it's going to contain all 3 plan options, the Economy, Choice, and Elite.
Dave, I understand we've also added the ability for your clients to choose the best premium option for their budget. Explain a little how this works.
Well, once again, one of the things we wanted to do was standardize the benefits and choices per each plan. The first thing we did, of course, is all three plans have a choice of including the United States or excluding the US. Quite often we get the question, hey, they're going to make a stopover in the United States or spend a day in the States before going to Aruba. Should we use this? Yes. Anytime your travel includes part of the United States, you must select the rates for including the US. Otherwise, it should always be excluding the United States. We standardize the medical maximums. Now all three plans have a choice from $50,000 to $5 million. The other standardization was the deductibles. We now go from a $0 deductible to a $5,000 deductible on all three plan options. To also help with consumer confusion, we simplified our trip links options. It used to be on the international was a maximum of 45 days. The continent was 187 days, and the Majestic was 3 years or 192 days. Now on the economy and choice, your clients can purchase a minimum of 5 days and continue to extend up to 364 days on the economy and choice. And then on the elite, they can continue to purchase up to 192 days or 3 years. I'll give some further clarifications on how we treat benefits and deductibles a little bit later.
Along with these improvements, we are also now offering fully integrated PPO incentives in the United States. Can you walk us through these as well, Dave?
Yeah, once again, all of our plans still continue to be open access, which means your clients can go to any provider they like. But now with the effects and impacts of having a UHC network, not only on your clients' out-of-pocket exposure, but also claims overall, they now have a choice, and we've incentivized them to go in network. And once again, we've tried to make it standardized and simple as possible. For economy, it's 80-20 in PPO, 70-30 out. Choice is 90-10, 80-20. And for those that really don't want any type of co-insurance, on the elite plan, it's 100% in PPO network, and out of network is 90-10. This helps reduce any balance billing in the United States. I also want to stress outside of the United States, it's still 100%.
This is a good time to add that we also want to share some great news for agents who are expanding their book of business through our diverse, fast-growing client base.
Yes, we're happy to announce this year that we are starting to do multilingual or bilingual capabilities in our new products. First and foremost, we will now be able to offer Spanish and English in these links. Of course, this will all be based upon what language or where the search engine is based or your client's utilizing. If it's a Spanish base, it'll automatically go to the Spanish version of the link. If it's English, they'll get the English version. And as we introduce new products this year, we'll continue to do this bilingual capability. That way we can address more of the market. Here's a summary now of our current travel medical plans. As most of you are insured professionals, I'm not going to go into a lot of details as I go through this. First and foremost, all of you are familiar once again with the International Continent and Majestic. Well, now we have one brochure that contains all three benefits. And the new brochure is the Liaison Travel Medical Series. We are in the process of updating the agent link and capabilities if you're used to or accustomed to personalizing your brochures. As of April 30th, our new brochure will be posted, as well as give you the ability through the agent portal to personalize it. When starting to go through the brochure, you'll see some design changes and so forth, but overall, it's still maybe the same content. As far as the product itself, first and foremost, it still provides temporary coverage, and it's still designed for travelers that are going outside, U.S. citizens traveling outside the United States, or non-U.S. citizens traveling anywhere throughout the world. As always, it's not intended to replace any type of private, government-sponsored, or national health plans. As well, it will still be non-ACA compliant, because it does not meet the definition of minimal essential coverage.
Now, I'd like to touch base on a basic overview of what the Liaison Travel Series plans are designed to do. That hasn't changed, but I think it's a good reminder. These are plans for people traveling for a limited time outside their home country or resident home country. This includes U.S. residents traveling abroad, non-U.S. residents traveling to the U.S., and non-U.S. residents traveling anywhere in the world. They'll fill the gaps where the domestic insurance doesn't cover for their country. And as Dave said, a reminder, these are not ACA compliant. Now let's look at who's eligible for one of these plans.
Whether your client is a U.S. or non-U.S. resident, a traveler is defined as one's own self. We then offer coverage for a spouse, domestic partner, or civil union partner. We've also had a category this year of travel companion, which can be a friend or colleague. No longer, if two people are traveling together, do they have to do separate applications? They all can be combined on one app. The other change is unmarried children over 14 days and under 19 years. And this includes children who are not related to you. I know of a case recently when one of our staff traveled with his wife, his 15-year-old son, and a 15-year-old travel companion. Under this new plan, all four of them could have gone on one plan instead of purchasing two.
I think it's important to note that coverage areas have not changed and still cover worldwide, including the U.S., and worldwide excluding the United States. Please note that due to carrier limitations, this plan will no longer offer coverage for U.S. citizens traveling to the United States.
Okay, Janice, well, let's talk about when coverage begins. There's a small change with that.
You're right. This wording is essentially the same, except that we added a time to the coverage start date. Coverage starts at the latest of the following: 12 a.m. U.S. Eastern Time, the day after we receive the application and payment online, or the moment you depart your home country, or 12 a.m. U.S. Eastern Time on the date requested.
Of course, the logical next question is, when does coverage end?
That is basically the same as well. We did a time, added a time to it too. So coverage ends at the earliest of the following: the moment you return to your home country, unless home country coverage applies, 11:59 p.m. U.S. Eastern Time, when you reach the maximum period of coverage, or 11:59 p.m. U.S. Eastern Time on the date shown on your ID card, or 11:59 p.m. U.S. Eastern Time on the end of the period for which the premium was paid, or the moment you are no longer eligible for coverage.
Now, Janice, I know I already mentioned a little bit about extending coverage, but can you go back over more so everyone truly understands how they can extend coverage on these new plans?
Okay, with the Liaison Economy and the Liaison Choice, if you initially buy less than 364 days of coverage, you can buy additional time up to 364 days. Your original effective date is used to calculate your deductible and coinsurance and to determine pre-existing condition. With Liaison Elite, it's a little more complicated, but if you initially buy less than 364 days of coverage, you can buy up a total of 1,092 days. That's 364-day periods. A new deductible and coinsurance applies beginning the 365th day and again on the 729th day. But your original effective date is used to determine pre-existing conditions. Your medical maximum does not begin again when you renew coverage. Okay, now, how can I renew my coverage?
Well, Janice, we send renewal notices to the primary member's email address at 37 and 1 day prior to expiration. Members can always renew online at www.renewal.sevencorners.com. So now let's get into the benefit comparisons. As I said earlier, most of you are insurance professionals, so I'm not going to go into every little detail, but I do want to highlight some of the changes we've made in the new plans. As far as the medical maximum options, you now see from 14 days to 69, all three plans offer from $50,000 to $5 million. Ages to 70 to 79, on including the U.S., are now have available $50,000, and ages 80 plus have $15,000 on the Economy and Choice and $20,000 on the Elite. When coverage is worldwide excluding the U.S., We have the same options for 14 to 69, 50,000 to 5 million. However, we have added a $100,000 option on the ages 70 to 79, and then 80 plus once again is limited to 15,000 on Economy Choice and 20,000 on Elite. We've also standardized the deductible options. All three plans now have the choice of a $0 deductible to $5,000. As always, coinsurance outside the United States is 100% in all three plans. And as I previously discussed, now that we've integrated the UHC PPO network, based upon the Economy Choice and Elite, they can go from 80% to 100% in network or 70 to 90% out of network. These plans continue to offer all the inpatient, hospital room and board, clinic services, emergency room, doctor's office, and prescription drugs. All three have the home health care benefit. All have a local ambulance benefit, hospital indemnity from $100 to $250, and a coma benefit from $10,000 to $50,000. All three plans continue to offer extensive benefits in a home country. As you can see, the benefits vary from $5,000 to $20,000. All include incidental trips to home country. Basically, that's still 5 days for every 30 days of coverage from $5,000 to $20,000. On waiver of a pre-existing condition for United States residents outside the United States, as you can see on the Economy and Choice, for 0 to 69, it's either 25 or 50. Age 70 over is 5 or 10,000. However, all emergency services and assistance are limited to 25,000. On the Liaison Elite, it continues to offer the same benefit as the Majestic or a competitor's more elite programs. If you have a primary health plan, it'll go from age 0 to 64 to the medical max. Without primary, it's limited to 50,000, 65 plus to 2,500, and then again, emergency services assistance are limited to 25,000. Acute onset of a pre-X for non-United States residents in the United States. You can see 0 to 69 goes from 15 to 50,000. Age 70 plus goes from 2,500 to 10. And once again, emergency services and assistance are limited to 25,000. These plans continue to offer dental sudden relief of pain and accident, as you can see, from 1 to 250 or 500 to medical maximum. They continue to offer such things as emergency medical evacuation and repatriation. And once again, this is in addition to the medical maximum, goes from 250,000 to 1 million. They include the emergency medical reunion, return of children, return of mortal remains, local burial, cremation, natural disaster evacuation, and natural disaster daily benefit, political evac and repat, felonious assault and terrorism. And as you can see, if you go from left to right, you can see the incremental increases in the benefit amounts. Once again, this is all in an effort to simplify choice. All include the 24/7 travel assistance, AD&D, common carrier AD&D. They all continue to offer loss of checked luggage, trip interruption, personal liability, and of course, hazardous sports as a optional purchase. Now, one change that you are going to find is that we are no longer including the rates in the brochure or the program summaries. We now have available separate rate pages. The first that you're seeing here is worldwide, excluding the United States. As you can see, it has orange highlights, provides you the medical maximums, and the bottom covers the deductible factors, hazardous sports rider factor, as well as any age limitations or how to rate for a child alone or with a primary. We then, in purple, will offer you the worldwide rates, including the United States. Same layout, simple and easy to read. Layout, deductible factors, all will be available either online via the website or available in the agent portal. Now, moving on. That was a lot of information, I know, but please remember, we're here to help you through this transition. Please feel free to contact us with any questions you may have.
Dave, I would like to add one additional change to the plans as an interesting offering. All three options include a new card that provides services and discounts to our insureds. It's called Well Card, and we are excited to include it with the plans. It's free to everyone. Insureds can use it and share it with friends and family, and they can continue using it even after their coverage has ended. Also, this card is much more than a discount drug card. It offers savings for prescription medications, dental, vision, hearing, diabetic care, vitamins, and daily living products. Information about the card will be attached to the fulfillment documents, and we will have a landing page on our site that explains the benefits in more detail.
Janice, I truly believe our insured members will be very excited about the new card. We are rolling this out in increments, so we'll be first started with our Liaison Travel series, and as we move forward with new and more programs going forward, the re-enhancements, it also will be attached to those. Now, I do want to continue to talk about geographic restrictions, for I know these questions come up quite often. We are still adhering to the state restrictions where we cannot accept an address in Maryland, Washington, New York, South Dakota, and Colorado. For those inbound visitors, please always remind them that they can continue to use their non-US address. I also recommend if their children or relatives here in the States are buying for them, once again, either at initial time of purchase or when they extend the coverage, to continue to use that non-US address. We continue to have the country restrictions. We follow the OFAC list. So countries such as the Islamic Republic of Iran, Syrian Arab Republic, U.S. Virgin Islands, Gambia, Ghana, Nigeria, and Sierra Leone will not be accepted as well. As far as destinations, the Islamic Republic of Iran and Syrian Arab Republic.
One question I hear frequently, Dave, concerns travel to one of the restricted states. You can still travel to these locations, like Dave says, but we cannot issue a policy to these locations. This is different from destination restriction, the second type of restriction. We can usually replace the address in the U.S. that's not used with the home country the person's traveling from. And as far as restricted countries to travel to, this is a short list. We cannot cover travel to these two locations, Islamic Republic of Iran and Syrian Arab Republic.
So Janice, how does an agent obtain a Liaison Travel Series links?
It all starts at the agent portal. The agent can access this portal at the bottom of our main website page, www.sevencorners.com. Simply click on Agents. Then, if the agent has already registered, they can click on Login at the top of the page. Enter the username and password, then click Login. If you don't know your username or password, contact us at sales@sevencorners.com. Then select the agent links and banners. You now have a choice of a text or an image link, at the Liaison Travel Medical Series.
You will need to select the link for the Liaison, as Janice said. We will no longer illustrate or view the Liaison International Continent or Majestic link. Once again, if you have one of these links on your website, there will be an automatic redirect to these links. Place the link on your website and you're ready to start earning money in their international market. We will have a document available on the agent site that will show a comparison of the plans side by side. It will show, for example, the difference between the Liaison International and Liaison Economy, since those two are closely related. It will also show comparisons for Liaison Continent and Liaison Choice, as well as the Majestic and Elite. Now, I know we've covered a lot today, and I appreciate your patience and time. And I do see that we have some questions. So I'm going to review those right now. The first question, can this be purchased by a family group of people traveling? Technically, yes. Once again, by the fact that we have travel companions, you can have someone other than a spouse. And once again, you can have other children other than your own dependent child. It will not cover 23 to 25 people. It's still recommended truly for an individual or family and their direct members. Next question is, how does a waiver of pre-existing condition benefit works for citizen going outside of the U.S.? Once again, that's a situation where on a pre-existing condition, as long as it's stable 30 days prior to departure, the situation is based upon the economy, choice, or elite. If it's determined to fall into that category of a waiver, we'll cover up to the maximum indicated in the benefit schedule. The next question I have, unfortunately for those in Spanish that are asking questions, I will have one of my reps after this webinar interpret those, and we'll get a response back to you. The next question I have is, what deductibles are assumed in the rate tables? The rate tables are based upon a $250 deductible. That would be the 1.0 rate factor. And then as you can see, it goes up to 1.25 for the $0 deductible, and then adjust downward for the anytime you raise your deductible. The question is, once again, someone came in a little bit late. Yes, the economy is replacing the international, basically. The choice is replacing the continent, and the majestic is basically a replacement with the elite plan. These plans, when will these all be available? We will officially roll all of these plans, or this plan, out with all options and materials on April 30th. So once again, if you have an existing link, it will automatically transfer over to the new links. However, you will be able to go in after April 30th into the agent portal and grab a new link. The next question I have is, can a person who resides in Russia buy any travel insurance plan? Yes, other than those countries or states that we've indicated where we're not allowed to accept a resident address in those countries, they may purchase this. Now, once again, if you're traveling to New York and live outside of New York, we can still provide services and provide coverage in that state. We just can't accept an address. The next question is, do you have customer support on Russian language? We currently offer about 10 languages in-house. What languages we don't have, such as Russian, we do have a language line which gives us immediate access to other languages. Next question, how do we obtain a hard copy brochure and rate sheets? As I previously indicated, on April 30th, these will all be available in the agent portal, as well as the ability to customize or personalize the brochures. They'll also be on our website as well when looking at the plan comparison. The restricted states, I'm close to running out of time, so we will post this, or you can call into the inside sales team. Most of those restricted states are already online and indicated on each of our plans, so I would suggest first and foremost go there. Otherwise, please feel free to call one of our inside salespeople. Question, allowed to write people who are in New York who are traveling outside of the US? Unfortunately, once again, that is one of the restricted states. We cannot accept an address in New York. However, if they have a home in another state that's not restricted, we'll be happy to accept that application. Will these plans have a purchase link, a separate purchase link for each plan, or one link? As I covered, there will be one link now that will take the consumers or your clients to all three plan options. Once again, we understand that some of you may have preferred one plan over the other, but after talking to consumers and agents, sometimes having a choice, as long as it's simple, can help make more sales and capture more business. One more question, has the travel quota link been cleaned up? We're still working on the same premise of the link. We do have future enhancements that we're considering to even make the purchase path even more consumer friendly, but at this time it'll follow our standard path that we have at this time. Final question. Can a U.S. citizen buy their own medical plan, assume they do have other coverage? These plans do not require that you maintain or have an existing plan in force. These plans, however, are secondary to any primary plan. So if your domestic plan does cover any portions of expenses, medical costs overseas, we would be secondary. If it does not, we would then be primary. All right, well, I'm looking right at my time. I have several other questions, But what we'll do is we'll take those after this webinar and we'll respond to you or post responses out on the website. We understand this may be a big change for a lot of you, but we truly believe after listening to you, our agents, and to our consumers, that this is going to enhance the consumer purchase experience with Seven Corners, as well as through the links that you'll have on your website. I also want to leave you with this. As we move forward, we're now looking at the student plan, the Wonder Frequent Traveler, and the Inbound series. So coming in the future, you're going to see a redesign of those products that will also have a economy, choice, and elite options. If you have any suggestions, we're working on them now. Please feel free to contact us. Otherwise, I want to thank Janice for her time today and everybody that's helped us on this webinar. And we look forward to our webinar next month. We'll send out an email notice to let you know the next product release, which will be the student series. Thank you very much for your time today and have a good afternoon.